Hello everyone, welcome to my channel. So today we'll be discussing the pathophysiology of osteoarthritis. So without wasting any further time, let's just get straight into the video. Alright, so what is osteoarthritis and what coins the term osteoarthritis? So as you know that osteo is bone, arthritis is joints, and itis states inflammation. But I want you to know that inflammation right here is a misnomer which does not contribute to osteoarthritis. Alright, so osteoarthritis is a degenerative disease which is due to the wear and tear. Now, what is the pathophysiology of osteoarthritis? Now, just quickly learn the pathophysiology of osteoarthritis. Alright, just focus on picture number 1 right here. So, here are two bones, alright. So, here are the two bones, and in between the bones, you can see a joint space. Now, look carefully at the diagram. Here you can find the articular cartilage, and also on the other side, this right here is articular cartilage. So this entire part, this entire thing is covered by membrane called the synovial membrane. Alright, okay. So in between the synovial membrane, here is the synovial fluid, and this acts as a lubricator. Now let's just think that this is a normal bone, okay? This is what actually occurs in normal bone. Now I want you to look at picture number 2. Alright, so what do you see in picture number 2? Yeah, what do you see in picture number 2? You see that the joint spaces right here, it's narrowed. Can you see that? Can you compare picture number 1 and picture number 2? You can clearly see that the joint spaces are narrow, or you can say that there is hardly any joint space left right here. So the joint spaces, it's narrowed. Alright, okay. Now what causes the narrowing of joint spaces? So let's just see that as you grow old and older, your joint spaces come closer to each other. So the presence of cartilage actually degenerates. Alright, the cartilage degenerates as you grow older, and the joint spaces come closer in contact with each other, so there is narrowing. Okay, alright, so now that you know that what causes the narrowing of joint spaces, and also there are certain other risk factors such as obesity, being a woman, and other medical conditions. In order to compensate this, the degeneration and the narrowing of joint spaces, the bone grows the bone spurs. Okay, they grow these bone spurs right here. These are the bone spurs, also known as osteophytes. Now, what do you think the most common clinical presentation of a patient with osteoarthritis will be? Take a guess. Of course, it's pain. So pain is the most common clinical presentation of patient with osteoarthritis. And now what causes this pain is this bony spurs right here, which due to wear and tear causes friction. So this friction actually causes pain. The other clinical features of patient presenting with osteoarthritis will be stiffness, swelling due to bony spurs, tenderness, and limited range of motion. So that's pretty much it about today's lecture. I hope this was helpful to you. I'll see you soon on the next lecture. Until then, bye bye. Take care.